everyone. Dr. Poonam Sambhaji here. So, Dr. Poonam, hi doctor. My son is 23 months old. He does not wear a mask nor a shield. His vaccinations are pending. Can I take him to health center for vaccination without wearing a mask? Please reply. I know this is a very common problem with children, okay, and whether there is COVID or there is no COVID, you have to take your child for the regular vaccination. I have mentioned this in many of my old videos also, wherein I have said vaccination is important. I have done a special video on this in my YouTube channel, the COVID season and the vaccination, the regular vaccination of kids. Do go through it. Now, how you are going to take the kid to the vaccination center? It's yes, you know, in children we say you need not wear a mask, but definitely everyone will be scared. See, a virus which is affecting us, why it wouldn't affect the child? If he doesn't wear mask, he can get affected. Yes, naturally he may get affected. But why science says no mask for kids is because usually the kids will not keep the mask like that on the nose and mouth. They will usually try to put their finger in the mouth with the mask in between, so they will suck on the mask, or they will start licking the mask. That is so it gets wet, and a wet mask is more infectious. That's why they say you need not wear a mask for kids. Okay, but when you go to such health centers and all, I hope they are taking the care of not crowding the people. I'm sure they must be doing that. Okay, so what you can do is best way out. What I tell my patients also is wear that monkey cap which the kids come with, monkey cap with the cap here, and then they have a half of the area which is closed here, only the eyes are open. Yeah, that is the monkey cap. So what you can do is wear the monkey cap, and inside the monkey cap where this area is there, apply a small kerchief, a piece of kerchief, just sew it in that area. Okay, so it is like a cloth, a cotton cloth, and plus he has the wool on top. Okay, so that should be more than enough for you. Okay, so you can do that for the mask. And for the shield, yes, there are some children who are really so cute, they wear the shield. Little bit bigger children, you can explain to them. Very small children don't put the shield. I think this should be more than enough. And as much as possible, maybe you can take one pallu or odni. त्याच्या वयर एक ओढणी घेयात. Okay, so that is for this. Next is Dr. Poonam, can I give vitamin C tablet for 9-year-old daughter as a precaution so that she may not get infection? If so, how many dose per day? विटमिन सी लहान भुरग्यांनी तुम्ही एकदम लहान भुरग्यांनी म्हणजे 5 वर्षाच्या सकयल्या भुरग्यांनी तुम्ही हाफ टॅबलेट दियात. दॅट इज गिव हाफ अ टॅबलेट ऑफ विटमिन सी. 5 वर्षाच्या वयल्या भुरग्यांनी 1 टॅबलेट. ओके, सो मोर दॅन 5 years यू कॅन गिव 1 whole टॅबलेट. इन एडल्ट इट इज 2 tablets. व्हडल्यांनी ती 2 टॅबलेट. ओके, सो दॅट वे यू कॅन फॉलो. See, vitamin C, water soluble vitamin. Okay, so it is not going to cause any problem even if it is in excess. So vitamin C हे water soluble vitamin असा, तुमका तेने काय प्रॉब्लेम जावचो ना excess जाले तरी. In case तुम्ही भिता की vitamin C दिवपाक भिता जाल्यार what you can do is give, as I said, include citrus fruits in your diet. So lemon sarbat, orange juice, santra juice, kiwi, watermelon, so many other vitamin C rich food. Someone had sent me, yes, that Loki, the dudhi popla, the dhava dudhi astano, the coconut dudhi, that juice is also good in vitamin C, but children are not going to take it. Adults can try it. Okay, also there is something known as ash god. It's called kohala in Marathi. I don't know in Konkani what do you call it. Okay, so it looks, you can just Google ash god, you'll come to know what it is. It is that same fruit with which petha is made in North India. Okay, so that is like totally colorless, odorless. Okay, you just mix it in the mixer, cut it and mix it in the mixer. It just doesn't taste much. I mean, there is no much taste. For kids, you can maybe make it into a sarbat and give it if at all they like it, because my kids drink it. If you make it into a sarbat, they drink it. I just drink it like that. Okay, so that is one more thing of vitamin C. Okay, next is hello doctor, I'm yesterday onwards, this is anonymous. Okay, there are some ladies who have told me take name as anonymous, so I hope those ladies will understand. I will just take their first name, because I think if first name is taken, no one will understand who the person is. So Sapna, from yesterday onwards we are all COVID-19 positive. My baby girl is now 20. So she had asked me earlier one question wherein only the husband was positive, and she's pregnant and her child is 21 months and and the servant who is there, they were all negative. Now unluckily they have also turned positive. So doctor, my baby girl is now 21 months and how to count her pulse rate and oxygen level. So Sapna, I have made a specific video for how to check this thing, pulse oximeter, the pulse, saturation and temperature in babies in Konkani and in English. Please go through it. Also her fever remains 96.2. So 96.2 is not fever, and sometimes it is 98.9. I am giving her Calpol 120. See Sapna, 99.5 and above, or just to be sure 100 and above degree Fahrenheit is fever. So everyone remember, भुरगे जावं, व्हडले जावं, जाणटे जावं, 100च्या वयर fever, 100 degree Fahrenheit च्या वयर fever, okay? Or in degree Celsius, if you want, 37.5 degree Celsius च्या वयर fever. So more than 100 degree Fahrenheit is fever, 37.5 degree Celsius is fever. These are two different ways, these are two different systems of temperature. So for most, for ease of understanding, okay, so चड तुमकां easy जावपाक जाय म्हणून आमी degree Fahrenheit 100 degree Fahrenheit म्हणून सांगतात. Now how to change it from degree to Celsius and Celsius to degree, I have already done my video in the previous video, the first few videos of mine which were not live. Yeah, you can go through them. I have shown how to change it. Plus, to remind you, I think RDX Goa, the local Goa channel, will be showing up my small videos which are around 3 minutes or 5 minutes, even 2.5 minutes. I've specifically done videos on request of public and on request of this channel, wherein they said they will just show those videos in between so that, you know, people are aware. So I made very crisp videos of how to use thermometer in Marathi, Konkani and English, then how to use pulse ox, again in all 3 languages, in adults and in the children. So that means total 12 videos of mine they will be showing somewhere in between, like, you know. So in whoever, why I have done that is, see, not everyone is on FB, not everyone is on YouTube and Instagram, okay. So there is a large population in Goa who is on these local channels. They are seeing the TVs. So that was a good opportunity I got to get into the root level in Goa, like, you know, where they are seeing TV more than mobile, where there is no much range, so they are glued to the TV over there, okay. So those people can see me even on the RDX Goa channel for those problems. And I mean for this issue, for this information. So Sapna, I think you got my answer. First of all, your temperature above 100 degree Fahrenheit will be fever, so don't simply give that Calpol 120 to the child. Also pulse rate and the oxygen, I told you, see my other video. So she has also asked, doctor, I am 4 months pregnant, which tablet I can take? Sapna, you take whatever tablet your doctor has already given you. Your doctor must have given you your calcium, your multivitamin and your iron, I think, yeah, iron syrup and all else. So you are just going to take them. Don't take anything more. Eat properly, sleep properly, don't take too much of tension, okay. आता झाला ते झाला, फुडें कितें आसा ते चड विचार करू नाका, कितें जातलें तेजे चड विचार करू नाका, सगळें बरें जातलें, ओके. देर आर फ्यू पेशंट्स, खूब कमी लोक problem आशिल्ले तांकां they are worsening, okay. Only few people with problems are worsening. So don't think of negative, only try to manage your temperature. I mean keep a monitoring chart of your temperature, pulse and saturation. तितून कितें वयर सकल जाता, any thing you are seeing that, okay, like saturation is going below 95, pulse is coming above 100, temperature is going above 100, inform your doctor who is following you, either from PHC, the doctor from PHC who has been who had seen you, or the doctor from whichever doctor will be in connection with you. Get connected with the doctor and inform them ki so and so is the problem, and the doctor who is following you, okay, don't simply call a doctor who doesn't know your problem. Many times it does happen with me also, because I have gone public. There are so many people who try to call me, and I had told this even in the older videos of mine, that I do not pick up unknown number, okay. Even on my clinic phone, I do not pick up my any unknown number for obvious reasons. You know, I get so many calls wherein they will say, doctor, baby just picked up the phone and rang. So it is like, for me it becomes really waste of time, you know, picking up everything. You have a problem, WhatsApp it to me, say that I am so and so patient from so and so area, this is my problem. You will get 2 auto messages, which are my auto messages on my business WhatsApp. So read them. If you see 2 ticks and you get Okay, if you see two ticks, that means I have seen it, I will address it. Also, many of them are asking me, doctor, when will you address my query? So it becomes very difficult for me to tell you when I will address your query. Can you imagine 10 pages of my this in questions? How am I going to address them in one day, or how can I give you a time that I will address you this time? Just be glued to the TV. Somewhere at around 1 o'clock usually I come online, but today, since it was Sunday, I just took the liberty and I was actually not going to come online, but because the number of questions really drove me mad, so I came online. Okay, so next question will go, though 10 minutes out, I will still continue. Okay, next question is, just want to know how vulnerable are infants to children or children between 1 to 5 year old towards COVID. Is it life threatening for them? See, they are vulnerable to the same extent that we are. Okay, now also we are, it is said that children are more spreaders. ते चड infection spread करता. तांकां जरी काय problem जाना आले तरी ते चड infection spread करता. So it is better to avoid taking them out. You know what I have noticed is, आता इतले सगळे problem सुरू असतात तरी भरपूर लोकांक भुरग्यांचे बारशे करप, भुरग्यांचे कितें तें 6 month बर्थडे पार्टी, 1 year बर्थडे पार्टी, 2 year बर्थडे पार्टी कित्याक करपाक जाय? स्टे एट होम, डू इट विदीन युअर सेल्फ. स्वतःचो एक केक करात, नाही ते एक केक विकत हाडात आणि कट करात. वॉट ग्रेट डिफरन्स इट इज गोइंग टू मेक की तुम्ही एक वर्साक एक बर्थडे पार्टी करू ना जाल्यार करात, पण घरातल्या घरान करात. वाय यू टू? अँड दॅट न्यू थिंग इज कम, सोशल पार्टी. आय डोंट नो वॉट इज दिस सोशल पार्टी. ओके, सोशल डिस्टन्स पार्टी. Okay, I mean, but there are, I think recently I had given one example of one wedding in whichever area in Goa. Okay, how the bridegroom suffered. He died at the end. Okay, and the wife was also positive. The people who had attended had also few had come positive. So why simply invite that disease? Okay, so best is avoid these parties and everything, because we do not know, anyone may be positive, asymptomatic, who may be coming to your house and spreading the disease. That poor guy or girl may herself won't know that she is positive. Okay, now next we go to so children are vulnerable. What symptoms do they have, or they when they are symptomatic? They can have any symptoms. They can have fever, body ache, cough, cold, loose motions, a very common thing. Okay, so I request you, if your child has fever, cough, cold, loose motions, please ask your pediatrician whether he or she can do a teleconsultation. Okay, like in my clinic, I do teleconsultation for all these people. So it saves the person coming out of their house. If at all there is anything goes this thing beyond a certain thing, like fever goes very high, goes more than 3 days, or loose motions are too many, then I guide them to go to which center or which hospital. That way what happens is, you are not exposed, the patient is not exposed to other people, their whole family members are not exposed to other people. You remain in isolation from minute 1, and also your doctor is not exposed to the infection. Okay, so what happens is, suppose there is, as it is very low doctors, okay, and you consider, I don't know the ratio in Goa, but in all over India it is very, very less doctors. On top of that, 570 doctors, our colleagues, have died in fight against COVID, which is not at all being recognized by any people, any higher authorities. Okay, so imagine that many people will be without the services of a doctor. Okay, so you need to save yourself, you need to save the other save the other community, you need to save we doctors also. Please have some courtesy from we doctors. Okay, so you are going to save that doctor and the patients who will be seen by that doctor. Understand? So if you have fever, cough, cold, loose motions, kindly request your doctor for a teleconsultation. There are many doctors who are doing teleconsultation, but they will find out who is the one who is doing teleconsultation in your area and go ahead. I had also made one post public before, I think in March or April, I had made one public post, I may post it on my page also, wherein I had spoken about teleconsultation. This is something I have been doing since last 8 years, even when it was not allowed by government. For the benefit of the patients, I was doing it, because there were many of my patients who were outside Goa, or who were not very close to me. So they would prefer the teleconsultation more than physical consultation for small problems. Okay, then